Hello, my name is Henak Mesmin, and this is my presentation on the misconception that psychological therapy, aka talk therapy or psychotherapy, is the same thing as talking to a close friend or family member. It is commonly said that having a really good conversation with a close friend or family member can be therapeutic. Often people take this notion to the next level by believing that just having these conversations can replace participating in legitimate psychological therapy. An example of this misconception discussed in everyday life is that it is common for people to exclaim that therapy is just for people who don't have close friends or don't feel comfortable talking to their friends about their issues. For the purposes of more context, in order to understand why this is a misconception, the differences between psychotherapy and regular conversation must be stated. Psychological therapy is administered by a licensed expert in the field of psychology, while conversations with friends and family are just conversations. A therapist's purpose is to always provide you with care, and that is not at all the primary purpose of friends and family. A therapist acts unbiased, is confidential, and has no relationship to you beyond talk therapy. All these factors impact your mental health treatment, and these factors would be heavily skewed, if not non-existent, if the therapy were to happen with someone that you knew personally. The evidence that this misconception is a misconception is that there is currently insufficient published research indicating that the conversation between family and friends is equatable at all to professional psychological therapy as treatment for any type of mental health problem. An aspect of this misconception that is supported by research is that having good friendships and close relationships with family promotes good mental health in general, which is also the goal of psychotherapy. Evidence for this is a study done by the Society for Research in Child Development, which found that the strength of close friendships of adolescents was directly correlated to the increase of self-worth and the decrease of anxiety and depression. So in other words, the closeness of your relationships with the people around you do affect your mental health, but there is no research or evidence suggesting that it has the same benefits as psychotherapy in mental health treatment. Though it may be said that good conversation with friends and family is an important part of maintaining mental health, the notion that it is able to replace psychological therapy is not found anywhere in scientific literature. Regarding my thoughts on this misconception, I first heard about this misconception through people I knew who strongly believed it. Personally, I never realized the scientific basis surrounding psychotherapy, and as a result, I believed that therapy was no different than talking about your problems to whoever you wanted to talk to. So my opinion has definitely changed since researching this misconception, as I now understand the purpose of psychotherapy, how it's practically implemented, and how it's more complex than a simple conversation just between two people. I think this misconception is so popular because people like myself, prior to researching, are ignorant to what psychotherapy really is, what it's trying to accomplish, and what it has accomplished in terms of treating mental problems. This misconception could be potentially dangerous, as people who could benefit from treatment hesitate from receiving it under the false assumption that they could achieve the same thing through conversation with friends and family. However, the larger implication of people believing this misconception is the broadness of treatment missed out on by people who need treatment who are not even considering any type of psychological therapy. Thank you.